Position the patient's head and neck into a neutral inline position with your forearms resting on the patient's clavicles and upper chest for stabilization. Now, while maintaining stabilization of the patient's head and neck, push each side of the patient's mandible forward until the lower jaw is extended. The first provider aligns the patient's head and neck in a neutral inline position. The patient's chin is now pulled forward and slightly towards the patient's feet to open the airway. The first provider opens the patient's airway with a trauma jaw thrust. The second provider sizes the OPA from the corner of the patient's mouth to the ear or angle of the mandible. The second provider inserts the tongue blade to a depth of about half the distance of the patient's tongue. Hold the tongue against the lower mandible, preventing it from being pushed into the posterior pharynx by the insertion of the OPA.
Why don't you get his head, and I'm going to get this nasopharyngeal in place here.
Lubricate the distal end of the NPA with a water-soluble lubricant. The second provider now sizes the outer diameter of the available NPA against the size of the selected nostril opening. Slowly insert the NPA into the selected nostril opening in an anterior to posterior direction, not towards the top of the head. Once the NPA is inserted, the first provider continues to maintain head and neck stabilization as well as the trauma jaw thrust.